Hello everyone and welcome to Claire Connolly Wellness. I'm Claire and today I'm going to teach you an ancient yoga breathing practice called Kapalabhati. Kapalabhati is one of the Kriyas in Hatha yoga. Now a Kriya is a cleansing technique, so very good for clearing out the whole of the lungs, also really good for this time of year when people have allergies, very good for burning out any mucus. It's a very invigorating practice and I'm sure you will feel quite on top of the world after the practice. Now Kapalabhati means shining skull breath. Kapala is your skull, Bhati means to shine. So the main aim of the practice is to clear the mind, and it really does feel like you are burning out the thoughts in a way. Just a few things before we get started. If you are pregnant, it's best to avoid this practice, especially we don't want to be contracting the muscles of the diaphragm too much if you're pregnant. If you have high blood pressure, then I would suggest that you give it a try, but you go a bit slower than the rate that we're going at and only stick to shorter rounds. Otherwise, you should be fine. As always, with any of these practices, if at any point the breath feels uncomfortable, then you must just stop and just return to natural breath. Now Kapalabhati is best practiced kneeling. Kneeling is not comfortable for everybody, so if you would rather sit in a chair or you'd rather sit on a cushion, then that's fine too. You can have the legs crossed. Bring the hands either one on top of the other if you know what you're doing. But if you're still new to Kapalabhati, it's quite nice just to place one just on your diaphragm here. It's a diaphragmatic breath. We're using the diaphragm through the breath. And the breath is practiced by having an active exhalation and a passive inhalation. It's a pumping breath. So it looks a bit like this. As you notice, the exhalation is active, the inhalation is passive. Exhale, 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 exhale. So that's how we practice it. We're going to practice 3 rounds today. The first round is going to be a slower, shorter round, just so you get used to how this breath feels. Then we're going to increase and go to a slightly longer round and then a longer round still. In between each of the practices, we're just going to take a big inhale and we're going to hold the breath just for 5 counts, then release and observe. Now, you don't have to do the hold. The hold isn't taught in all practices, but I really feel like it feels really nice to do the hold. But again, as I said, you take it all at your own pace. Okay, starting with the eyes closed, you maybe have one hand on the belly, or you can have the hands in Dhyana Mudra here, one hand on top of the other, thumbs connecting. Take a full deep breath in and exhale, just let it go. And inhale, take a half breath and begin. Exhale, exhale, exhale. Inhale, take a full deep breath in and just hold at the top for 5, 4, 3, 2, 1. Exhale and release. Now just resume your natural breath and just notice any changes in the body. Maybe you feel like your heart rate increased a little bit. Maybe you feel a heat coming up around the shoulders. So we're going to take a slightly longer, slightly quicker round now. Remember, if it gets too much, stop. Listen to your body. And if you have any high blood pressure, you might just want to stay with a slower, shorter round. Take a full deep breath in. Exhale, let it out through the mouth. Inhale a half breath. So keep this beat and keep your shoulders still. Keep your jaw and chin parallel to the floor. Exhale, exhale, exhale all the way out. Take a full deep breath in and hold the breath for 5, 4, 3, 2, 1. Exhale and release. Again, just resume your natural breath. Just notice for any changes in the body. Kapalabhati, shining skull. Can you feel your skull shining? Maybe you feel a slight lightheadedness, slight fizziness through the head, through the face, through the teeth, tingling in the fingers. You might feel something else. Sometimes you feel like you want to cough. Sometimes you feel like you want to sneeze, as we're burning out the mucus in the respiratory system. It's very good for you, for many systems in the body. So one final round, and this one is the longer, slightly quicker round. So again, please just take it all at your own pace. You know, you might not be ready for this longer round just yet. So if you get a few breaths in, you think I need to slow down, I need to stop, then you just stop. Okay? Take a full deep breath in. Exhale, let it go. Inhale a half breath. And begin. Exhale, exhale, exhale. Inhale all the way in and hold the breath. Exhale, let the breath go. Resume normal breath and just observe the practice. Notice how easy it is to breathe now. Notice the coolness in your respiratory system. Notice the strength of your respiratory system. Bring the hands together just to complete this practice. Being grateful for these teachings, for being able to experience the gifts that the practice brings, not just physically but also emotionally. Take a deep breath in. Namaste.